Okay, so this video is going to be about Latissimus dorsi and Teres major. Latissimus dorsi is the broadest muscle of the back, and very much like trapezius, even though it is big and wide, it is very thin, so it is difficult to palpate and difficult to grasp. Teres major, on the other hand, is quite small. In fact, Teres itself means rounded and slender. So we have two very different muscles that are going to do the exact same thing because Teres major and Latissimus dorsi are synergists. We had talked about antagonists in our video on the deltoids. This time we have two muscles that do the same thing, synergists. Let's get right to it, shall we? Come on. There we are. Okay, so Latissimus dorsi and Teres major. This is Latissimus dorsi right here. See, it is broad, it is flat, it is superficial, like trapezius. So it is the most superficial muscle in this area. However, like I said, it's very difficult to palpate simply because it is so thin. Usually you feel what's deep to it, not latissimus itself. Teres major, on the other hand, like I said, is quite small. You can see that it is sort of rounded. I think it's more rectangular, finely shaped, a cylinder. Teres major is Lat's little helper. It's a nice way of remembering it because they have the same actions. Lat's little helper. Okay, so let's get right into the origins and insertion of Latissimus dorsi, and then we'll talk a little bit about Teres major. Okay, so Latissimus dorsi origin is the inferior angle of the scapula, spinous process of the last 6 thoracic vertebrae, last 3 or 4 ribs, thoracolumbar fascia, and posterior iliac crest. There's a lot to unpack there. Okay, so first of all, this whole white area here is all connective tissue. And on both sides of the low back, since they're only showing one, the whole thing is called the thoracolumbar aponeurosis. Thoracolumbar. So it's the thoracic and the lumbar together. Thoracolumbar aponeurosis. And aponeurosis is just a broad, flat tendon. That's the definition. Aponeurosis, broad, flat tendon. But anyway, it's connective tissue that attaches down into the sacrum and the iliac crest here, and it's really tough, and a lot of muscles attach into the thoracolumbar aponeurosis. So this is just one of them, but I wanted you to know what that is. And of course, the posterior iliac crest, you don't know the hip bones yet. It's fine. Again, you just kind of have to memorize this for right now. Eventually, we'll learn all of this. Okay, the muscle then comes up this way in a diagonal all the way up to the humerus, right? You can see that right there. It makes a little bit of a twist and inserts on the anterior humerus at the intertubercular groove of the humerus. Who remembers the other name for the intertubercular groove? That's right, it's the bicipital groove. Bicipital groove because the bicep tendon goes through there, right? There it is, right there. So it is going to come up, make a little bit of a twist, and then insert right there. So the origin is way bigger than the insertion. And let's take a look. All right, so here we are. Here's the little teeny tiny insertion. Okay, all of the origins. So this is the inferior angle of the scapula. which is the first one, inferior angle of the scapula, if you're looking at your book, page 71, has the origin and the insertion. 72, as you can see here, has the visualization of the origin and the insertion. Okay, so inferior angle of the scapula. It's got a little bit of attachment there. Then the external surfaces of the last 5 or 6 or whatever, last 6 thoracic vertebrae would be here. 1, 2, 3, 4, 5, 6. Last 6 thoracic vertebrae. So if you wanted to rewrite this, you could write it out as the T 6 through 12. Because remember, we're talking about thoracic vertebrae and they're all numbered. So if it's the last 6, it's going to be 6 through 12 because there are 12 of them. So again, if you're a visual learner, T6 through T12 or T6 to 12 is easier to visualize than last 6 thoracic vertebrae. The words are harder. Okay, so we have the inferior angle of the scapula. We have T6 to T12. And then we also have, it says the last 3 or 4 ribs. Okay, last 3 or 4 ribs. You have to understand, even though humans are put together pretty much the same, there's a lot of variation. And so that shows up sometimes in our anatomy texts. So last 3 or 4 ribs. Okay, fine. Then it has the thoracolumbar fascia and posterior iliac crest. So what it's indicating here on the spinous processes is where that fascia attaches. So where the thoracolumbar aponeurosis attaches to the spine. Okay, that's what that is. And then here is the posterior iliac crest. Oops, I don't need that. Posterior iliac crest. So this whole thingy right here is the iliac crest. We're just talking about the last part of it. Okay, that's it. The insertion, again, is the intertubercular groove of the humerus, so pretty easy. All right, let's go back to the actions. All right, actions of Latissimus dorsi. Remember, the insertion moves closer to the origin. And since all of this is the origin and this up here is the insertion, we know that we're going to be moving the humerus, right? Yeah. So we have extension of the shoulder, adduction of the shoulder, and medial rotation of the shoulder. Now, if you put all of those together in order, you get the handcuff position. Now, I'm sure none of you have ever been in handcuffs, but you've seen it on TV and you know what it looks like, where your arms are extended behind you, your shoulders are medially rotated, and your arms are together in adduction. So the shoulders pulled together, right? So as you can see, Latissimus dorsi and teres major are sometimes called the handcuff muscles because that's what their actions mimic. If that is helpful to you, great. If it's not, don't worry about it. Extension of the shoulder, adduction of the shoulder, medial rotation here, medial rotation of the shoulder. The thing is, they kind of happen in extension, okay? Extension, adduction, and medial rotation. So let's go into Latissimus dorsi here. Let's do shoulder extension. Latissimus dorsi are also the muscles that are really developed on swimmers, because they're constantly pulling through the water, right? They're using extension, and that's Latissimus dorsi. So you can't see, actually, let me see if I can fade that. Fade, fade, fadey, fade, fade. Let's fade that one. Okay, just so you can kind of see where latissimus comes up right there, right where my arrow is, and inserts on the anterior of the humerus, right there. It's hard to see, but it's right there. All right, let's swing him back around a little bit. And you can see shoulder extension. Okay. Adduction is not hard to visualize because you're just simply bringing this closer to the spine or closer to the midline. So you are adding to the body. And then medial rotation, you'd think, well, but the muscle's on the back, so it should be lateral rotation. No, because the insertion is on the anterior. So even though most of the muscle is on the back, the insertion is on the anterior. So let's swing him around here for a second. Make him smaller. Make him smaller. There we go. Oh dear, we're having some issues. Come on. There we go. Okay. All right, so because this muscle wraps around the middle, around through the midline of the humerus here and attaches in the front, it comes up around and attaches, it has to go back towards latissimus origin. If it would wrap all the way around the back of the humerus and attach in the front, well, then it would certainly be lateral rotation, but because it comes up between the scapula and the humerus and kind of makes a left turn at Albuquerque and inserts on the anterior humerus, it actually pulls the anterior humerus into medial rotation as the humerus goes towards the midline of the body, okay? Right here is what we're talking about. It pulls this way into medial rotation, okay? Now that was just kind of hard to visualize as well, but it's fine. We can palpate it in class. All right, so moving on to Teres major. This is Lat's little helper. It is little, and it does the exact same actions as Latissimus dorsi. So we have extension of the shoulder, adduction of the shoulder, and medial rotation of the shoulder for Teres major. Now the origins and the insertions are completely different, and they're also a lot smaller. Yay! So the origin is the inferior angle of the scapula and lower 1/3 of the lateral border of the scapula. So it's just describing this whole area here. Inferior angle and lateral border, lateral 1/3. Okay. If you are a visual learner, turn this 1/3 into an actual visual fraction, like write out 1/3. Okay. That way you can associate that with Teres major in a visual way. All right, and then it comes straight across basically. It also attaches to the anterior humerus, so it kind of goes around the humerus a little bit, and then inserts on the crest of the lesser tubercle of the humerus. If you remember, you had the greater tubercle and the lesser tubercle, right? Remember? And remember they each had a little crest, sort of, right? That came down off of the tubercles. So this is the crest of the lesser tubercle of the humerus. The actions are the same because they are synergists. Teres major is Lat's little helper again. And if we go back into these actions, right there is Teres major. And you can see in each one of these, as you go through the actions and as you go through the muscles, Teres major and Latissimus dorsi will always be shown together. Okay, because they do the same thing. Okay, Teres major and Latissimus dorsi. Now, there is a little bit of extra information about Latissimus dorsi in your book at the bottom in one of those gray boxes. This is talking about how Latissimus dorsi can affect the spine and the hip, because remember, it does attach to the spine and the hip at the thoracolumbar aponeurosis. Though they are not major actions, they are still worth considering. So I encourage you to read the little gray box at the bottom of page 71. All right, next up would be pectoralis major and serratus anterior. See you soon.